what are you doing?
Carly and I are filming a video on breast changes, That's what we're doing here.
Dude, the project isn't about breast changes in your pecs. It's like breast changes like breast cancer.
Oh, then we need to go to the library.
I know. Alright, let's head there.
Alright, now that I know where I've gone wrong, let's talk about the actual breast changes.
Yeah. Let's do it.
Yeah, that sounds like a good idea.
So these are the Tanner stages, the normal development. For stage 1, this is pre-puberty, nothing's really happening yet. Stage 2, this is the beginning of puberty, so the areola starts to get a little bit bigger. In stage 3, the areola is the same size, but we're starting to get a little bit more breast tissue. And then stage 4, there's even more breast tissue. And by stage 5, they are fully developed, and this happens at a wide range of times for all the girls going through this, but this is post-puberty, fully developed. So, as you can see, there's many different shapes, sizes, and colors of breasts, and it just depends on the woman because there's no set normal of breasts. Some breasts can be very large, or there's smaller ones. Some can be asymmetric, some can be saggy, some areolas can be bigger than others, and it just really depends on the woman. There's no set normal, like I said, and the main reason for showing all of these is because you just need to know what your normal is, and so if it strays from that baseline, that's when you know that there's something going on. A normal time in a woman's life when her breasts will change in a normal fashion is when she gets pregnant. So her pre-pregnancy breast might look like this, and then after, once she gets pregnant, there will be a lot of changes such as stretch marks and veins, and they'll get enlarged. And then I will break that down by trimester and what you can expect your boobs will change during those trimesters. So in the first trimester when you're pregnant, your breasts might change by being enlarged, tender, and you might see some blue veins. And then in the second trimester, you'll still have the blue veins, but your areolas will get darker and you might see some areolar bumps. And then in the third trimester, you might see some stretch marks and you could have some milk production. So that's all I have on normal breast changes during puberty and during pregnancy. And now we're gonna go to Jordan with benign breast changes.
Thanks, Carly. Benign breast changes are breast changes that stay local to the breast and are non-invasive, and they don't migrate elsewhere throughout the body. There are two main categories of benign breast changes. The two main categories of benign breast changes are cystic changes and benign solid changes. So the main differentiation between the two is that cystic changes contain fluid in the mass and benign solid do not contain fluid. So we're going to talk about the two major examples of each more in depth, but the two major cystic changes are fibrocystic and mastalgia, and then benign solid are fibroadenomas and galactorrhea. So the most common benign breast change of both categories are fibrocystic changes. They most commonly occur in women aged 35 to 50 and occur as a result of hormone changes. Most commonly, the hormone change is associated with progesterone and estrogen, but it also involves other hormones like prolactin. Major signs and symptoms include tenderness and lumpiness in the breast, and they are diagnosed first with an ultrasound, and if this is suspected, then they go to a mammogram. The most common treatment associated with fibrocystic changes are dietary changes. So what this includes is smoking and alcohol cessation, drinking less tea and coffee, exercising more, and so those are the main dietary changes. And if the tumor has already advanced, then surgical removal is required. The second type of cystic benign condition that we're going to talk about is mastalgia. That's another word for breast pain. Signs and symptoms are exactly the same as the fibrocystic changes, lumpiness and tenderness. The most important thing with this is assessing the character of the pain, because the mastalgia could be occurring for a variety of reasons. If the cause is unknown, it's typically treated with NSAIDs. So the most common benign solid mass is a fibroadenoma, and they occur in women aged 15 to 30, and they're the most common adolescent mass. It tends to remain the same size even throughout the menstrual cycle. Treatment is usually surgical removal if the symptoms don't resolve or if the lump is suspicious. So the last benign condition we're going to talk about is galactorrhea. Galactorrhea is bilateral milky discharge with elevated prolactin. It's a normal finding during pregnancy, but what we're concerned about is if it's spontaneous or blood comes out along with the milky discharge, because that could mean a pituitary tumor of some description. This is diagnosed through prolactin labs and then most likely a mammogram following. That's all we got for benign. Now we're kicking it to Joey for some malignant changes.
Thanks, Jordan. Now we're talking about malignant changes. And so the difference between a benign and a malignant change is about how invasive it is. So a malignant change in the breast will present similarly as a lump or something, but it can metastasize and go throughout the body and enter the lymph nodes and everything, and so that's the difference between those two there. Alright, so now we'll talk about some risk factors for malignant breast cancer. And so one of them is advanced age, so as you get older, the women tend to get more breast cancer. Family history, so if you had a family history, if you had a mom with breast cancer or anything like that, that can increase your risk for it. Genetic mutations, that has to do with the family history. So the two big genes are the BRCA1 and 2 genes, and so if there's genetic mutations in there, that has been shown to lead to more malignancies. And then the age of the first live birth, and there's many more risk factors for malignant, but these are just the main ones that we'll talk about. So there's a lot of different types of breast cancers, but the two main categories of breast cancers is ductal and lobular. And so it's kind of about where it originates from. And so ductal carcinoma is the most common type of breast cancer, and it begins in lactiferous ducts, and so it begins in the ducts, and that's pretty important for that. And then for lobular, all these types of cancers, there's many of them, they originate in the lobules of the breast. And with both of them, and in all breast cancer, it begins in the epithelial cells, and so that's really important. So some signs and symptoms of breast cancer, pretty similar to benign, but it can pop up as a palpable lump or a thickening in the breast, and there can be some redness and edema, or just changes from baseline that a woman is noticing about her breasts. And so for screening, like I said, like self-checks regularly are good to making sure that your breasts aren't getting any different or finding any lumps. And then the yearly mammogram, which is important for early detection. And if there is a suspicion of some sort of lump that could be malignant or a tumor, then a doctor may order a biopsy, and then they can really see if it's malignant, and they can look at the lymph nodes and see what's really going on. And then for treatment, if they do find a malignant cancer, then they might do a lumpectomy, which is just removing the cancer, not the whole breast, or a mastectomy, where they do remove the whole breast. And then a lot of times these treatments can be in combination with radiation or chemo, and just to make sure that all the cancer has gone away. Okay, now we'll go over a proper breast exam. So you're gonna lay back, and you're gonna put your right hand under your head, and then you're gonna take your other hand, and then you're going to feel around the breast with these 3 fingers, making sure to use the pads of your fingers, and then feeling at a light pressure, a firm pressure, and then a medium pressure, and making sure to go around the whole breast. And then you're just going to do the same thing on the other side, going to that breast, doing the same procedure. And then if you have any questions or you feel anything, please don't hesitate to contact your healthcare provider. Thanks for watching.
Hope you really enjoyed it and you learned a lot.
Where's Jordan?
1, 2.
Jordan, what are you doing?
I'm serious about those breast changes. I'm going to the gym right now.